Good mornings. In the wards, we usually get the patients with altered mental state or altered sensorium. So, what are the various etiologies we should rule out in these type of patients? So, this is a table we will discuss today. Firstly, we should rule out any vascular cause, that is, any stroke, which can be ischemic or the hemorrhagic stroke. Then infections like most importantly UTI, respiratory tract infection like pneumonia, sepsis, encephalitis, and meningitis. Third causes toxic causes. In that, any history of drug abuse, drugs, over the counter drugs, any addictions like patient taking alcohol, benzodiazepine, barbiturates, or heroin, and history of intoxication and overdose. Fourth is any history of trauma because concussion and STH can lead to altered mental status. Then autoimmune causes like SLE, neuropsychiatric lupus, neurobashids, vasculitis, ADAM. Important cause is thyroid related uh, altered sensorium, which is Hashimoto encephalopathy, which is also called as SREAT, that is steroid responsive encephalopathy with autoimmune thyroiditis. Then autoimmune encephalitis like autoimmune limbic encephalitis. Then the important cause is metabolic cause, in which we have the electrolytes like hyponatremia, hypernatremia, hypercalcemia, hypermagnesemia, and hypophosphatemia. So, besides sodium, what are important? Hypercalcemia, hypermagnesemia, and hypophosphatemia. In the endocrine causes, we have thyroid related disorders like hypothyroidism, hyperthyroidism, hypocortisolism, hypercortisolism, hypoglycemia, hyperglycemia. Then hepatic encephalopathy, uremic encephalopathy, acute pancreatitis, hypoxia, hypercarbia, vitamin deficiencies like thiamine, B12, hypothermia, hyperthermia. Then important causes are porphyria and Marshall-Faba syndrome. Now, the neoplastic causes like large brain tumors, carcinomatous meningitis, paraneoplastic limbic encephalitis is also an important cause. Seizure related is post-ictal state or non-convulsive status epilepticus. In the structural causes, we have hydrocephalus, and degenerative causes. The cause can be DLB, prion disease, and you should rule out any psychiatric disease. So, what are the various investigations which we will need? First important is CT and MRI to rule out ICSOR, to rule out stroke. Then it can help in autoimmune encephalitis also. Then we need to rule out the various infectious causes. So complete hemogram with ESR, urine routine examination, CRP, Procal. Then toxic profile should always be sent in each patient. STH can be ruled out on CT scan. Various electrolytes besides sodium, you should send the calcium, magnesium, and phosphate levels also. TFT should be done, serum cortisol should be done, and sugars. LFT, RFT, ABG, that is important cause. In vitamins, B1 and B12 can be set. In neoplastic causes can be ruled out on MRI or CT. Any history of seizures should be taken because it is a post-ictal state or non-convulsive status epilepticus. Hydrocephalus will be ruled out on CT, and degenerative causes can be ruled out on history. So this is the list of the causes of altered mental status. Thank you.